Let me ask you something. If your smoke alarm went off right now, would you wait 10 minutes to see if it was a false alarm? Of course not. You'd act immediately. You wouldn't stand in the kitchen thinking, well, I don't actually see any smoke yet. But when the brain sends its own alarm signals, numbness on one side, sudden dizziness, words that won't come out right, most people over 60 wait an average of 30 minutes before calling for help. 30 minutes. I'm Dr. Marcus Adebayo, physician and cardiologist. Today, I'll show you exactly what those alarm signals look like and exactly what to do the moment you hear them. Surviving a stroke and surviving a stroke well. Those are two different things. I want you to understand that distinction clearly. I've been practicing cardiology and internal medicine for 28 years. I've sat with hundreds of stroke patients during their recovery. What I've observed consistently across all those years is that outcomes are not random. They're not luck. They follow a pattern. The patients who walk out with minimal lasting damage almost never say, I waited to make sure. They say, something felt wrong and I called immediately. The patients with the hardest recoveries almost always say some version of the same thing. I thought it would pass. I didn't want to bother anyone. I waited about an hour. 1 hour. That hour is not neutral. That hour has consequences that last years. Adults over 60 face a particular challenge with stroke recognition, not because they're less capable, but because stroke symptoms can overlap with things common at this stage of life. A little dizziness, some fatigue, feeling unsteady. These things happen for many reasons as we get older, and that creates a habit of explaining them away. It's probably just my blood pressure. I didn't sleep well. Reasonable explanations for a lot of things, but dangerous explanations when what's happening is a stroke. Every minute that a stroke goes untreated, the brain loses approximately 2 million neurons. 2 million cells gone in 60 seconds. By the time an hour has passed, that's 120 million brain cells that could have been saved. That's the biology of what's at stake. So what I want to give you today is simple. A clear picture of the brain's alarm system, a step-by-step protocol for the first 3 minutes, and the understanding of why every step matters. Because hesitation is what separates the two outcomes. And you have the opportunity right now, today, to decide which outcome you're going to be in. I want you to picture a fire in a building, a contained fire, in one room. The room is already burning, but the rooms next to it, they're filling with smoke. Those rooms are not gone yet, but they're in serious danger. And the outcome depends entirely on one thing, how fast the fire department gets there. That's what a stroke looks like inside your brain. When a stroke occurs, either a clot blocks a blood vessel, cutting off oxygen to brain tissue, or a vessel ruptures, flooding surrounding tissue with blood that doesn't belong there. The cells at the center begin dying within minutes. That damage is permanent. But surrounding that core, there's a larger zone of tissue in danger, but not yet lost. Neurologists call it the penumbra. I call it the smoke-filled rooms. Those cells are starved for oxygen, struggling, but still alive. If blood flow is restored quickly enough, a significant portion of those cells can be saved. That's the brain you get to keep. That salvageable zone doesn't stay salvageable forever. With every passing minute, more cells cross the line from struggling to gone. Modern medicine has clot-dissolving medications and endovascular procedures that can retrieve a clot from inside a brain vessel. These treatments work when administered in time, but they have a window, roughly 3 to 4.5 hours from symptom onset. After that window closes, options narrow dramatically. When the brain's alarm goes off, the treatment is ready. The team is waiting. The only question is whether you open the door in time. Every minute you wait is another room lost. Your brain has a warning system. Most people just don't know how to read it. The system I use is called B FAST, all 6 signals, including the 2 most people miss. B, balance. A sudden unexplained loss of coordination, not ordinary dizziness. Your legs feel unreliable. You reach for something and miss. That's the alarm activating. E, eyes. Sudden blurred vision, double vision, or a dark patch appearing without warning. And this one gets dismissed constantly. A brief episode where vision in one eye went dark for a few seconds and then returned. That is not nothing. That is your brain telling you the blood supply is compromised. F, face. Ask yourself or the person to smile. Is one side drooping? Does one side feel numb? Sudden facial asymmetry is a classic stroke signal. A. Arms. Hold both arms at shoulder height. Close your eyes. Hold for 10 seconds. Does one arm drift downward? Does one side feel significantly weaker? That asymmetry is a direct signal from your brain. S. Speech. Struggling to find words. Sentences coming out scrambled, slurring from nowhere, or understanding everything perfectly, but being unable to respond. Any sudden change in speech is serious. T. Time. The moment you notice any single one of these, not two, not three, you call immediately. No observation period. One more signal outside the acronym. A sudden catastrophic headache, arriving in seconds, unlike anything before. Patients describe it as an explosion. That can indicate a hemorrhagic stroke, a ruptured vessel. Do not take pain medication and wait. Call. Before today, did you know all 6? In my experience, most people know 2 or 3. Now you know all 6, and that changes everything. When you've recognized the signal and made the call, your job shifts to protection mode. 4 rules, each one with the reason behind it. Rule 1, get horizontal, get safe. Do not stay standing. Stroke can compromise your balance without you fully realizing it. You may feel steadier than you actually are. A fall during a stroke creates a compounding emergency. Head trauma, broken bones, on top of an already critical situation. Lower yourself carefully using whatever is available. The floor is completely acceptable. Rule 2, position yourself on your side, not flat on your back. Either side, knees slightly bent. Stroke can affect the swallowing reflex without obvious symptoms. Lying flat on your back creates aspiration risk. Lying on your side eliminates that risk almost entirely. Rule 3, nothing enters your mouth. Not water, not food, not your daily medication, not aspirin. Stroke has 2 fundamentally different causes, a blockage or bleeding in the brain. Aspirin can worsen a hemorrhagic stroke significantly. You cannot tell from symptoms alone which type you're having. That determination requires imaging. Leave it to the paramedics. Rule 4, control your breathing deliberately. In a medical emergency, blood pressure rises and adrenaline floods the system. In a stroke, that elevation can worsen the situation in progress. 4 counts in through the nose, 4 counts out through the mouth. This activates the parasympathetic nervous system, moderates the stress response, keeps oxygen levels stable. This is not just calming, it is active protection of the tissue that's still salvageable. Let's talk about the phone call. This call, how you make it, what you say, is one of the most consequential actions you will ever take. Step 1, call 911, full stop. Not your doctor, not your family, 911, immediately. An ambulance is not faster transportation. It is a mobile medical unit carrying stroke protocols, neurological assessment tools, and in many cases, initial medications. Every minute that care begins earlier matters for that salvageable tissue. Do not drive yourself. Do not have a family member drive you. Call. Step 2, say the exact phrase, I think I am having a stroke. Those 6 words activate a stroke protocol in dispatch systems across the country. The right team gets alerted. The hospital gets notified before you arrive. 6 words that change the entire trajectory of your care. If you are calling for someone else, I think this person is having a stroke. Same protocol activation. Same response. Step 3, give your address slowly and clearly. If confusion affects you, and confusion is a recognized stroke symptom, not a personal failure, describe your location. A street name, a landmark. Step 4, stay on the line. The dispatcher monitors your condition in real time, guides your positioning, and relays updates to paramedics en route. Even if your speech goes, leave the phone connected. An open silent line is information that dispatchers are trained to act on. Step 5, unlock your front door. Before you get into position, this saves paramedics critical minutes of forced entry. Unlock it, then return to your recovery position. If a trusted neighbor's number is already in your phone, a call after 911 is placed is worth making. If you live alone, your sequence is modified. And I want you to know it precisely, not approximately. First, the phone call. Not the door, not repositioning, the call. Make it while your speech and cognition are at their clearest. Stroke can progress quickly, and that window may be shorter than you expect. Use that window immediately for the most critical action, getting emergency services on the way. Second, after giving your address, go to the door, unlock it. Then position yourself somewhere visible near the entrance, somewhere paramedics find you immediately. Never drive yourself or ask a neighbor to drive you instead of calling 911. I've seen that decision made with good intentions. It consistently produces worse outcomes. If you have a medical alert device, activate it without hesitation. For adults living alone over 60, this is not a luxury. It belongs in the same category as a smoke detector. One final instruction for those living alone. If your speech goes before you finish the call, do not hang up. Leave the line open. Your silence is information. I want to tell you about a patient I'll call Ronald, 64 years old, retired engineer, fit for his age, walked every morning, managed his blood pressure, came in for checkups without being reminded. One evening watching television, his right hand suddenly felt weak. Not painful, not numb exactly, just unreliable. He tried to change the channel and his fingers didn't cooperate the way they should have. It lasted about 4 minutes, then resolved completely. His hand felt entirely normal. Ronald reasoned his way out of it. Maybe he'd been gripping the remote too tightly. He went to bed, slept normally, felt fine the next morning. 6 days later, Ronald had a major stroke. What Ronald experienced was a TIA, a transient ischemic attack. I want to retire the term mini-stroke entirely because it does exactly the wrong thing. It makes the event sound small, not urgent. A TIA is a temporary disruption of blood flow, producing symptoms identical to a full stroke that resolves because the clot cleared before permanent damage occurred. The symptoms go away, the underlying problem does not. Think of it as the smoke alarm going off and then going quiet. The smoke cleared, but the faulty wiring that caused it is still there, and it is significantly more likely to cause a real fire in the next 48 hours. The data is unambiguous. Approximately 1 in 5 people who experience a TIA will have a full stroke within 48 hours, many within 24. Ronald's hand weakness lasted 4 minutes. Those 4 minutes were the most important warning signal he ever received, and he talked himself out of responding to them. The rule is absolute. Symptoms appeared, even briefly, you call. You get evaluated. You do not wait to see if something else happens, because something else happening is exactly what you are trying to prevent. The ambulance is coming. Everything you've done, recognizing the signal, making the call, unlocking the door, getting into position, all of that was right. This waiting period is not passive. It is active medical management of your own condition. You are creating the best possible environment for the brain tissue that is still salvageable. You are the first responder, and you are doing your job. Stay conscious and stay engaged. Stroke creates a powerful pull towards sleep. The brain under stress wants to shut down. Resist that pull actively. Talk out loud if you are alone. Describe the room. Count backwards. Say your name. If someone is with you, keep responding, even a word, even a nod. A patient who arrives conscious and responsive gives the medical team real-time neurological data. Your level of consciousness at arrival is a clinical variable that affects treatment decisions. Do not allow yourself to be moved by untrained hands. Family members will want to help. Ask them clearly to wait. Moving a stroke patient incorrectly causes additional injury. Record the time your symptoms began. Say it out loud. Ask someone to write it down, or leave a voice memo if you're alone. The precise onset time determines treatment eligibility. It calibrates the treatment window calculation. It is not paperwork. It is clinical data. You can gather it before any medical professional arrives. Think of it as the first thing your medical team needs from you. I want to come back to where we started, the smoke alarm. When that alarm goes off, you don't debate it. You don't wait for visible flames. You respond immediately, because you understand instinctively the cost of responding when it turns out to be nothing is zero, and the cost of not responding when it turns out to be real is everything. Apply that exact same logic to your brain. The balance, the vision, the face, the arms, the speech, the catastrophic headache, those are your brain's smoke alarm. They are not subtle suggestions. They are not things to monitor for 20 minutes. They are the alarm going off. And the appropriate response is immediate action, every single time. The medicine exists. Right now, in hospitals across this country, treatments that can dissolve a clot, restore blood flow, and preserve function that would otherwise be permanently lost. The technology is not the limiting factor. The personnel are not the limiting factor. You are the variable. Your decision, in the first 3 minutes after that alarm goes off, determines which outcome you land in. The one where you walk out, or the one where you don't walk out the same way. I've watched both outcomes happen many times. Over 28 years. The patients on the better end are not luckier, they are faster. They responded to the alarm. You now know what the alarm sounds like. You know be fast, all 6 signals. You know the 4 rules for your body. You know exactly what to say when you call. You know to unlock the door. You know what a TIA actually means. You know the waiting period is active management. That knowledge lives in your hands now. Here is what we covered today. 1. Every minute of untreated stroke costs approximately 2 million brain cells. The treatment is ready. Your job is to get there while the window is open. 2. Know your alarm system. Be fast. Balance, eyes, face, arms, speech, time. Add the thunderclap headache. Any single signal you call immediately. No observation period. 3. 4 rules for your body. Get low and stay low. Lie on your side, not your back. Nothing enters your mouth. Breathe deliberately. 4 counts in, 4 counts out. 4. 911 only. Say, I think I am having a stroke. Stay on the line. Unlock your door. Note the exact time symptoms began. That timestamp is clinical data. 5. If you live alone, call first, door second, position third. Medical alert device is not optional. Trusted neighbor's number in your phone. Today. 6. A TIA is a warning shot. Symptoms appeared and resolved. You still call. 1 in 5 TIA patients has a full stroke within 48 hours. There is no version of that where waiting is the right response. A question for the comments. Before today, did you know what a TIA actually meant? Did you know about the balance and vision signals in Be Fast? I ask every patient I see about this. The knowledge gap is consistent. If this was new for you, it is almost certainly new for someone sitting next to you in your life right now. Share this video with your partner, with your adult children, with your neighbor, your friend from church, your golf buddy, the person you walk with every morning. You don't know whose smoke alarm is about to go off, but the people in your circle who have this information are the people who respond when it does. Subscribe if you haven't. Every week, direct, evidence-based medical guidance built specifically for adults over 60. No overwhelm, just what you need to know. You showed up today. You paid attention. That is you deciding your health is worth understanding, and I have nothing but respect for that. Stay well, act fast. The alarm only has to work once to save everything. And finally, everything in this video reflects general medical information based on current clinical guidelines. It is intended for educational purposes only. It does not constitute personalized medical advice and is not a substitute for the guidance of your own physician. Please consult your doctor about your personal stroke risk, your medications, and any symptoms you may have experienced. That conversation may be the most important medical appointment you keep this year.